Apart from the pharmacological treatment, we sometimes resort to surgical treatment in patients who are not responding to the drug therapy. So as we went through the fact that the history taking is important, and then we move on to the physical examination in the particular patient, and then we decide what kind of a management the patient is going to respond to. So it's again very important that you focus on the fact that first of all, you not resort to the surgical treatment right away. You're going to try on treating the underlying causes. You're going to carry out the investigations and look for any positive findings in the investigations, and you're going to treat the underlying causes first of all. It can be the metabolic causes, it can be the infectious states, and on the other hand, it can be the tumorous conditions as well. So whatever the cause is, the treatment of the underlying cause is very important. But so far, when we see and we look at the patients and they're not responding to the anti-epileptic therapy in a particular way, and they have that consistent phases of the seizure activity, we might resort to the surgical treatment as well. We have a variety of surgical treatments out there that we can resort to. There are a lot of researches going on, and depending upon the individual patients, we can resort to these particular surgical treatments as well. They have proved to be very beneficial and fruitful in a lot of cases. Now, temporal lobectomy is one of the surgeries that we can resort to. So sometimes, as we focused on the fact that in a lot of cases the temporal lobe is involved. So depending upon what lobe is involved, we can completely remove that lobe which is involved in the abnormal excessive paroxysmal neuronal activity, and we can completely remove that lobe, and that is going to result in a very improved kind of a condition in the individual. So it can be even the frontal lobe, it can be the occipital lobe, it can be the parietal lobe, and whatever the case is in that particular individual, the radio imaging is going to help us a lot in that instances. Amygdalo-hippocampectomy is one of the states in which the amygdala, the hippocampus is involved, and the primary pathology is thought to be in these particular nuclei. So we can completely get rid of those nuclei, and we have an improved states seen in these individuals as well. Then we have the lesionectomy. So if it can be even two or more of the lobes is involved, and we just completely get rid of that particular lesion in the individual, and that is going to even be quite beneficial for the patient. Then we have the hemispherectomy, in which the complete cortex is involved. We have the corpus callosectomy. The corpus callosum is sometimes involved, and after removing this corpus callosum, the patient state is quite improved, and basically the patient shows a lot of improvement in the overall condition. Now moving on, we have the temporal lobectomy, and as we can even see over here, this is basically the temporal lobe. As you can evaluate over here, either we can completely remove the temporal lobe, or if we can resort to, we can just remove the lobes that are involved, which we are focusing on when we carry out the radio imagings. We can just complete the exact lobe or the exact lesion that is involved for that particular case. And this is basically the basilar view. We have the lateral and the basilar view, just enhancing the fact that the temporal lobe can be removed completely. And in a lot of patients, it has resorted to a very improved state overall. So we can have the patients in which we can resort to amygdalo-hippocampectomy. So in which basically a lot of patients are suffering from pathologies of amygdala or hippocampus, and after the removal of amygdala or hippocampus, we can have these particular patients that can quite improve after this removal. We have the lesionectomies, in which a particular lesion is seen in either of the lobes, either the frontal lobe, the parietal lobe, or the temporal lobes are seen over here. Whatever the case is, removing that particular lesion, removing that particular tumor can be quite fruitful and beneficial in these patients as well. Then we can have hemispherectomy, in which the complete hemisphere is involved. We can have the right hemisphere or even the left hemisphere which is involved. So the removal of the complete hemisphere is sometimes done for the individuals who are not responding to the pharmacological treatment, and we can resort to this extreme levels of the surgical excision as well. Then we can also resort to the corpus callosotomy. The corpus callosum is basically the fissures which are responsible for the communication between the two lateral hemispheres. So sometimes this is the underlying pathology in a lot of patients. After the removal of just this corpus callosum, the patient improves a lot in the overall state. And as you can even see over here, this particular corpus callosotomy is done. The corpus callosum is completely removed in a step-by-step manner, and that results in in a lot of improvement and a lot of clinical improvement in the patient. So obviously, all of these surgical treatments have their own pros and cons, and they are also sometimes coupled up with a lot of adverse effects, but sometimes they have to be resorted to, and it's basically the risk versus the benefit ratio that you're going to weigh for the patient and then obviously manage accordingly.